This is what thousands of patients are saying online right now. And if you're considering dental implants, you need to hear this before making your decision. I'm not here to scare you away from implants. They can be life-changing for the right person. But today, we're diving deep into the real reasons why some patients regret their implants, the hidden challenges nobody talks about, and most importantly, how you can avoid becoming one of these regretful patients. Stay with me until the end because I'll share the exact questions you should ask your dentist before moving forward. Let's get started. Section 1. The reality check. Here's something most dental clinics won't tell you up front. Dental implants have a success rate of around 90 to 95%. That sounds amazing, right? But let's flip that number. It means that 5 to 10% of patients experience some form of failure or complication. When you're dealing with your smile, your health, and thousands of dollars, even a small percentage matters. So why do patients regret their decision? The reasons are more complex than you might think. It's rarely just one thing. It's usually a combination of factors that patients weren't prepared for. Let me break down the 7 main reasons patients express regret. Section 2. Reason number 1. Unrealistic expectations. The first major reason is unrealistic expectations. Social media and dental marketing often show picture-perfect smiles achieved in just one day, or pain-free and easy. But the reality is different. Dental implants are a surgical procedure. The complete process can take 3 to 9 months from start to finish. You're not walking out with a perfect smile after one appointment. Here's what actually happens. First, you need the surgical placement of the titanium post into your jawbone. Then comes the healing period, called osseointegration, where the bone fuses with the implant. This alone takes 3 to 6 months. Only after this can the crown or artificial tooth be attached. Many patients expect immediate results and feel disappointed when they realize they'll be waiting months with temporary solutions. The lesson? Ask your dentist for a realistic timeline and understand each phase of the process before starting. Section 3. Reason 2. The financial shock. Let's talk about money, because this is where many patients feel blindsided. A single dental implant can cost anywhere from $3,000 to $6,000. If you need multiple implants or additional procedures like bone grafting or sinus lifts, you could be looking at $20,000 to $50,000 or more. But here's the real problem. Most insurance companies consider implants cosmetic and won't cover them. Patients often discover this after they've already committed to the procedure. Then there are the hidden costs nobody mentions. Maintenance appointments every 3 to 6 months, potential repairs or replacements over time, medications and pain management during recovery, time off work for surgery and recovery. One patient I spoke with said, "I budgeted for the implants, but not for the bone graft I needed first. That added another $4,000 I didn't have." The solution? Get a complete written estimate that includes all potential additional procedures. Ask about financing options and payment plans up front. Section 4. Reason number 3. Chronic pain and complications. This is the one that truly affects quality of life. While most implant procedures go smoothly, some patients experience ongoing complications. Nerve damage. If an implant is placed too close to a nerve, it can cause numbness, tingling, or even chronic pain in your lips, gums, or chin. This can sometimes be permanent. Peri-implantitis. This is essentially gum disease around the implant. It causes inflammation, bone loss, and if left untreated, can lead to implant failure. Studies show about 20% of patients develop some form of this within 5 to 10 years. Sinus problems. For upper jaw implants, improper placement can penetrate the sinus cavity, causing chronic sinus infections and headaches. One patient shared, 3 years after my implants, I developed constant pain. Turns out the implant was failing and I needed it removed and replaced. That meant going through the whole process again. Important point, not all pain is normal. Initial discomfort for a few weeks is expected, but chronic pain lasting months is a red flag. Section 5. Reason 4. Poor candidate selection. Here's a harsh truth. Not everyone is a good candidate for implants, but not every dentist will turn away a paying patient. You might not be a good candidate if you have uncontrolled diabetes, affects healing, are a heavy smoker, reduces success rates by up to 20%, have severe bone loss in the jaw, have certain autoimmune conditions, take medications like bisphosphonates for osteoporosis, or have ongoing periodontal disease. Some dentists will proceed anyway, leading to predictable failures that leave patients feeling betrayed. One reviewer wrote, "My dentist never told me that my smoking would dramatically reduce my chances of success. 2 implants failed within a year. I wish I'd known to quit smoking first or choose a different option." What you should do: be completely honest about your medical history. If a dentist doesn't thoroughly evaluate your health before recommending implants, that's a major warning sign. Section 6. Reason 5. Implant failure. Even when everything is done correctly, implants can still fail. Early failure happens within the first few months when the bone doesn't properly integrate with the implant. This can occur due to infection, insufficient bone quality, or excessive pressure too soon. Late failure occurs years later, often from bone loss around the implant, mechanical issues with the implant or crown, poor oral hygiene leading to infection, or excessive grinding or clenching, bruxism. When an implant fails, it needs to be removed. You then face a difficult decision. Try again with another implant or choose a different tooth replacement option, like a bridge or denture. The emotional toll is significant. Patients describe feeling frustrated, embarrassed, and worried about wasting even more money on a solution that might fail again. Critical tip: choose a dentist who offers a warranty or guarantee on their work and uses high-quality implant brands with proven track records. Section 7. Reason number 6. The recovery reality. The recovery process is often harder than patients anticipate. First 24 to 72 hours, significant swelling and bruising, pain requiring prescription medication, difficulty eating, mostly soft foods and liquids, potential bleeding. First 2 weeks, continued dietary restrictions, difficulty speaking clearly, social self-consciousness about appearance, multiple follow-up appointments. 3 to 6 months, ongoing dietary caution to protect the healing site, anxiety about whether the implant is integrating properly, and lifestyle limitations. One patient explained, "I scheduled my implant right before my daughter's wedding. I had no idea I'd be so swollen and in pain. I could barely smile in the photos. I should have planned better." Many people underestimate how this recovery affects work, social life, and daily activities. My advice? Plan your implant surgery around your life schedule. Avoid major events for at least 2 to 3 weeks afterward. Section 8. Reason number 7. Choosing the wrong provider. This might be the most preventable cause of regret. Not all dental professionals have the same level of training in implantology. Some general dentists offer implants with minimal additional training, while periodontists and oral surgeons specialize in these procedures. Warning signs of an inexperienced provider: rushing you into a decision without thorough evaluation, not taking 3D imaging or CT scans, offering prices significantly lower than competitors, no clear explanation of risks and alternatives, defensive when you ask questions, limited before and after photos of actual patients. What successful patients do differently. Research the dentist's credentials and specific implant training. Read multiple reviews from different sources. Ask how many implant procedures they perform yearly. Request to see actual patient results with consent. Get second or even third opinions. Verify they use reputable implant brands. Remember, the cheapest option is rarely the best option when it comes to surgical procedures in your mouth. Section 9. How to avoid regret. Let me give you a practical action plan. Before your consultation: 1. Write down all your questions. 2. Research different tooth replacement options. 3. Check your insurance coverage details. 4. Set a realistic budget including potential complications. During your consultation, ask these questions. What is your specific success rate with implants? Am I a good candidate, and why or why not? What are the risks specific to my situation? What is the complete timeline from start to finish? What is the total cost, including all potential additional procedures? What happens if the implant fails? What type of implant brand do you use and why? Can I speak with previous patients? After deciding to proceed, 1. Follow all preoperative instructions exactly. 2. Quit smoking if you smoke. 3. Optimize your overall health. 4. Plan for adequate recovery time. 5. Commit to excellent oral hygiene. 6. Attend all follow-up appointments. Conclusion. Look, dental implants transform lives every single day. They help people eat confidently, smile freely, and feel like themselves again. But they're not magic, and they're not right for everyone. The patients who regret their implants are usually those who weren't fully informed, had unrealistic expectations, chose the wrong provider, weren't good candidates to begin with. You don't have to be one of them. Do your research, ask tough questions, choose quality over cost, and make sure you're making this decision for the right reasons with the right information. If you found this video helpful, please give it a thumbs up and subscribe for more honest dental health information. Drop a comment below if you have questions about implants. I read every single one. And remember, your smile is worth the time it takes to make the right decision. I'll see you in the next video.